Good evening, everyone. Good evening, viewers. This is Real Men's Talk, where it is sizzling hot, interactive, and informative. Today, we'll be discussing what is the lifestyle, what is the health, what should be the health habit, the health lifestyle post retirement. We are aware that post retirement, most people will be above 60. And this is the age in which so many challenging health activities will come up. With me in the studio today is Dr. Charles Atimon, a seasoned family physician, fellow West Africa College of Physicians, and a consultant family physician to the Federal Medical Center Award. He will be taking us through what we need to know about our health after retirement and how to prevent them. Dr. Charles Atimon, good evening.
Good evening, Dr. Samuel. Good evening, everybody. Thank you for giving me this opportunity to discuss, to speak this evening.
Thank you very
By
much,
the
Dr.
way, the topic of today's presentation is preparing for healthy retirement life. Preparing for healthy retirement life. As the last speaker just said, rightly said, the person that did the introduction, the person of Dr. Samuel, retirement.
Dr. Atimon, sorry, here we have one of the co-hosts.
Retirement plans, retirement, and post-retirement. All these segments or stages in life are very, very important. Before I proceed to this presentation, I want to put us through the outline of today's presentation.
So just when you are talking,
what is retirement?
Okay.
Health and retirement. Retirement and aging process. Common complaints and medical problems during and after retirement. Then pre-retirement medical evaluation, diagnosis and management of current illnesses. Then the preventive measures from primary, secondary. Continuity of care, the role of natural foods and supplements. That is lifestyle, which is very, very important. Then maintaining physical, social, and mental activities. Then we conclude. By the way of definition, what is retirement? This is the point where a person stops employment completely, or the person decides to leave the labor force if he or she is employed. A person may also semi-retire by reducing working hour, which is very important. What I mean here is this: to be semi-retired, maybe you resume your duty, maybe the normal working hours are between the hours of 8 a.m. and 4 p.m. You now decided to reduce it from 8 a.m. to 12 noon. Basically, an example of semi-retire. That's by reducing the work hours. Many people choose to retire when they are eligible for private or public pension benefits. This is very, very important, because before you can be qualified for a pension, that benefit in Nigeria context, you must have worked in an organization for a minimum of 10 years. Thereby, some are also forced to retire when physical conditions do not allow the person to work anymore. Maybe the person is not capable Maybe there is a sickness that is preventing the person to work, to be productive in his or her daily activity. Previously, most workers continued to work until death as there was no pension arrangement. However, Germany was the first country to introduce retirement in the 1880s. But nowadays, most countries have a system to provide pension on retirement in old age. Pension may be sponsored by employers, the state, or through the contribution by both employer and employee. That is what is currently on in the Federal Civil Service. But unfortunately, we all had a case of pension funds. So I don't want to go to that because of this presentation. Today, retirement with a pension is considered a right of the worker in many societies. Although a worker may retire at whatever age, the country tax pension rules often stipulate a standard retirement age. For example, retirement are vary from country to country, but is generally between the age of 55 and 70. In Nigeria, retirement in civil service is at the age of 60 or 30 or 35 years in active service. But for judicial workers in Nigeria, retirement is between the age of 65 and 70. However, status is one of the major factors affecting people retirement decision. It depends how productive you are, how capable you are to continue with your day-to-day activities in the labor force. In general, declining health over time as well as the onset of new health conditions have been found to be positively related to earlier retirement. For instance, if somebody suddenly a diagnosis of a terminal illness is made, for instance, a cancer, all those things, it can definitely bring a halt to the retirement without the person being planned to retire at that point in time. When the person is not capable or is no more, it can no longer cope with the activities of the work. Retirement has effect on various aspects of life, including health, wealth, employment characteristics, and family dynamics, among others. By the way of definition, before I proceed, I want to remind us of what is health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. This is very important because during the retirement, post-retirement, the physical, the mental, and social well-being of an individual is very, very important. During retirement, there are challenges to all these three. Vis-a-vis the complete physical state, mental state, and social well-being. Extensive study has been conducted to understand the long-term consequences of the retirement process. There are a lot of studies that have been done in US, in UK, in Germany on the retirement process, and even the study are still going on. Health of retiring varies by socio-economic status, especially educational status of the income of the patient. All these things are very, very important. If you work in any society that the health issue is not functioning well, the health care of that individual is not very taken care of, it can have effect on your own productivity. Health has an impact influence on retiree ability to work. That has been defined in 2002. Lifestyle factor influence retiree health and physical well-being. For instance, heavy drinking, smoking, and sedentary lifestyle, overweight, obesity, and worsening health status. Although we are still going to discuss this thing because we say health is wealth. Although prevention is always better than cure, there are other preventive measures that I'm going to bring up to as this presentation continues. All people use alternative medicine and supplement to a surprising degree. However, nearly half are seen a this thing, and 20% are used massage therapy. There are other alternative medicine for in our environment. A lot of people don't actually believe in the conventional medicine. So, in view of that, there are a lot of things that needed to be done. Because when you tell for instance, in this context, now you tell an average Nigerian to come to hospital and have a routine medical check-up done, they will tell you that somebody who has not earned a salary for the past 6 months, you want the person to come to the hospital and spend thousands for a routine medical checkup. All these things are very important. It's just because our NHS is not working maximally the way it should work. However, advancing age is associated with an increased prevalence of a number of diseases and other health problems. Example, arthritis and hypertension are the most common condition. Other include cardiac problems, diabetes, cancer, lung disease, and cardiovascular problems. So all these things are very, very important. Apart from the health problems that an individual may have prior to retirement, many of the health challenges are consequences of the aging process. It's not really most of the time we associate this in that whenever you retire, you are going to retire. A lot of people retire to sickness and all those things. That is one of the reasons that this presentation is very, very important. You should know what to do when you are very productive. You should know what to do, how to take some steps, how to take some preventive measures, because whatever life you live will have an effect, either positive or negative, when you are aging. Aging refers to irreversible biological changes that may occur in all living things with the passage of time. Let us briefly review this aging process. I want us to listen to this. You will understand wherever you are, you understand some biological process that are going on, that is currently going on. In the 30s, the basal metabolic rate starts to decline. Bone mass increases to the age of 35. Then muscle mass and strength is at the peak at 35. I want just you to know that if you calculate your age now, if you are 30 or 30, well, there are some activity that you can do that you do with ease when you are 20, when you are 10 years of age. But if you try this now, if you try, you can't even try half of it at this point in time. Those are the things that I want you to understand. We talk of basal metabolic rate. It's basically the energy expeditions when you are at rest, when you must have fasted for about 8 hours. All those things are very, very important. As you are aging, all these things are getting declined. After 35, functional capacity begin to decline. After 35 years of age, functional capacity begin to decline in almost every organ. Body organ become less efficient. That is your kidney, your liver, your pancreas. That is why you begin to understand why type 2 diabetes mellitus tend to set in at the later age. Because most of these organs, like the pancreas, the beta cell in the pancreas that secrete your insulin, the function of the pancreas begin to decline. The heart is begin to decline in activity. The kidney begin to decline in activity. So the cardiac output begin to decline. Even the reproductive function begin to decline at 35. These are very important. We should take note of this. Then in the 40s, more fat begin to store in the abdomen, hip and thigh region. This is very important. We should take note of this. Their body weight increases. Muscle mass and strength begin to go down. Skin starts to thin and lose elasticity and become drier, leading to wrinkle, front line, and all those things. All these things are very, very important. We should take good note of this. Then menopause may set in a woman, leading to rapid decrease in bone mass because estrogen and all those factors are declined. So bone mass decline. The osteoporosis setting. That is why osteoporosis is commoner in women at that postmenopausal stage compared to men. There is something in thinner and fragile bone. Their vision begin to decline, taste begin to decline, the set of smell begin to decline. Then in 50s, the body fat and weight continue to increase. Skin become drier with more wrinkles. Sagging begin to show around the eyebrow and neck. It's very, very important. These are inevitable biological process that we must all go through, either we like it or not. No matter the level of our care, we must go through all this biological process. Then in women, menopause set in with the distribution of fat in the waistline. Virtually all organs begin to lose their function. As I earlier said, the heart, the kidney, the lung, the pancreas. That is where most of these diseases begin to set in at these ages. Then in the 60s, there's rapid increase in the rate of bone loss with shorter stature and more fragile bone. That is why you begin to see elderly fall in the elderly, sustaining fracture of the head of femur or any fracture in any part of the body because of the osteoporosis that are setting. Then degenerative changes occur in the vertebral column with curving of the thoracic spine and reduction in height. Then blood vessels begin to lose elasticity with the reduction of blood flow to most organs. Then intelligence, memory, and learning usually remain preserved. Then in the 70s and beyond, there's significant decrease in body weight. Muscle mass, bone mass and water content decreases. There's loss of mass in the liver, kidney, lung, and nerve, and all those other parts of the organ in the body. Then bone become more porous and prone to fracture. There's decline in nerve conduction, joint mobility, muscle contractility, and so on and so forth. It is very, very important for us to understand all these processes, because either we like it or not, we will undergo these biological processes. Because before we move on, I want to just bring our attention to the book of Ecclesiastes 12:1-6. Remember now that Creator in the days of thy youth, while the evil days come not, nor the year draw nigh. In the day when the keeper of the house shall tremble, that is your arms, and the strong men shall bow themselves, that is your legs, and the grinder cease because they are few, that is your teeth, and those that look out of the window be darkened, your eyes, and the door shall be shut in the street, your ears, when the sound of the grinding is low, that is your mouth. And he shall rise up at the verge of the bed, and all the daughter of music shall be brought low, the sun, and the almond tree shall flourish, the white hair, or ever the silver cup be loosed. This is very, very important. We should take note of all this. Your arms become weak, the legs become weak, the teeth are the teeth in the mouth are reduced, the eye, the vision is reduced, the ear is reduced. It's very, very important for this. Before we now move on, let's look at the common complaint and medical problem after and during retirement. It's very important for us to understand this, as we earlier said earlier, that every organ of our body is being affected as we are aging. As we are aging, the organ of our body also aging as well. It's just like that. It's just like you go to the market today, you buy a brand new car. The moment you start the car, you start the ignition, you drive the car, I want you to know that it's no more a new car. The same thing is applicable to human being. As you are growing, you are working, your strength begins to decrease. Every system in your body begins to decrease. It's just unfortunately that in this part of world, most of us use our productive time to serve the government. The time that we're supposed to be enjoying, we're supposed to be relaxing, we are now managing one ailment or the other. Prevention is better than cure. That is one of the reasons for this lecture. It's very good for us to know the steps we should take, the preventive measures that we should take in order to halt the progressive of this, or to even avoid this thing completely. Number one, there are common complaints: overweight, poor appetite, dizziness and facing, sexual dysfunction, vision problem, distorted sleep pattern, urinary problem. All these are very, very common. Some elderly will come to you in the clinic. I have not been sleeping. I only sleep for 4 hours. I only sleep for 2. The sexual dysfunction, visual problem, then gray hair loss, constipation, social isolation, economic problem, age discrimination in employment. For instance, now we all know that if you are applying for any work at this point in time, any employment, or there's an advert, if you are 45 years and above, you apply. With those who are 20 in their 20s, it will be very, very difficult for you to get social employment because of age discrimination. Then hypertension, that is elevated blood pressure. Diabetes is a chronic medical condition that is characterized by hyperglycemia due to fat, protein, and carbohydrate defect in metabolism. As a result of decreased insulin secretion or defect in that insulin, or both. In this, diabetes is very, very important. I want us to really understand this thing, because these are lifestyle, these things that the lifestyle affect this thing. These are preventable things. We can halt the progression. It depends on the life we are living. Are very, very important. That is why, as we are aging, it's always advocated we reduce our sugar consumption, most especially the simple sugar. We reduce our carbohydrate consumption. All these things are very, very important, because at that point in time, the pancreas, the beta cell of the pancreas that secretes insulin, is no more as efficient compared to when you are young. The osteoarthritis, bone pain, knee pain, very common in the knee. The osteoporosis, the bone becomes friable, any little fall, the bone break, then bone fracture, stroke, glaucoma, coronary heart disease, depression, senile dementia, suicide, elder abuse, increased cancer rates. We know that as we age, the aging is one of the risk factors for a cancer. That is why, before now, we used to discuss and discuss of communicable diseases in our environment. SCDC, not communicable and not very common, but now we are discussing something we call double burden of disease. Both the communicable and not communicable, they are taking over in this part of the world. So what are we going to do? How do we evaluate this thing? There's something we call pre-retirement medical evaluation. That is why I want to implore everybody in this your productive year. There are some basic test investigation that you can do early, because once these things are detected earlier, to manage them are very, very important and very, very easy. They can be managed. They respond well to proper management. It's very, very important for us to understand this. Management of health in retirement should start with a medical evaluation before or immediately on retirement. That is why we are advocating for routine medical checkup. Come to the clinic. If you are 30, if you are 40, basic urinalysis, we can get a lot of information. Basic eye check, we can get lot of information. Basic PCV can tell us a lot of things. Routine PCV check, routine eye check, routine basic breast examination. All those ones are very, very important. This should be performed by family doctor, preferably a family physician or any other doctor can carry out all this pre-retirement evaluation that has long-term care commitment to the retiree. The evaluation will involve compilation of the claimed health data, which are very, very important. The present illness, the past history, either previous history of admission, previous history of any illness, past medical or surgical history, past blood transfusion, those are very, very important. Then the family history. There are some diseases that are familiar, like hypertension, you take a history. Is any of your family hypertensive? Diabetes, you take a history. Is any of your parents have diabetes? And all those things are very, very important because of the familiarity. Then the social history. Do you drink? Do you smoke? If you smoke, how many pack? How many do you smoke? If you drink, what is the quantity? The recommended quantity. Past medical history are very, very important. Then you review other systems. The physical examination, head-to-toe examination, then you record previous investigation that the person had, then you begin to compare it. What are the previous investigations you have done? I have done random blood sugar before, I have done PCV before, I have done past smear before. Now you compare the result with the current result with you. The above exercise will review current illnesses and the need for further investigation. If there are certain things you think or the suspicion that are suspicious, maybe you are suspecting cancer, you are suspecting one thing or the other, then you can take a further step for a proper high-falutin investigation for you to get a proper diagnosis to know what you should do next. Appropriate optical management should be instituted for such identified disease. It's not a good this thing that you see, you have go home, come back. No. You must start something as soon as possible. There may be need to screen for existing complication of the disease that may be present. Then medication may need to be reviewed. Then follow-up care is also planned, because it's not just enough for you to see, okay, go home. No, you have to do proper follow-up for the patient, for you to get other things that may not have gotten at the initial evaluation. So what are we going to do? How do we prevent this? Are they preventable? Diabetes, cancer, cardiovascular disease, chronic respiratory disease, and other NCD. Are they preventable? Are there things that we can do to reduce the risk? Are there the risk reduction programs that we can institute? What are those things that we can do? How is our physical activity? How is our diet, the healthy diet? How do we smoke? How is our weight? Are we controlling our weight well? Is there any history of harmful useful of alcohol? All these things are very, very important. Those are the preventive steps that we need to take in order to curb all these things. It's very, very important. Then for our prevention, how do we do it? Is there anything like prevention in medicine? Are they helpful? Can this prevention, can they do anything good to us? It's very, very important for us to understand. For our primary prevention, this is basically refers to intervention aimed at preventing disease from occurring. You don't want it to occur at all. What are those things I'm going to do? What are those things that can prone somebody to lung cancer, to carcinoma of the lung? What are those things that can prompt somebody to type 2 diabetes mellitus? All those things are very, very important for us to do. It involves avoidance of risk factor, healthy promotion, as well as specific protection. Attention to the paid to the following: diet. Eat a variety of food, a food that are basically available in your environment. You have to understand your cultural milieu whenever you want to choose any diet. Diet rich in vegetable, diet rich in fruit, diet rich in whole grain and fiber, but low in simple carbohydrate and saturated fat. All these things are very, very important. Most especially the diet containing high level of carbohydrate, cholesterol, and all those things. Basically, these are not good for this age group. They are not good at all. We want to watch what we eat. More of fruits, more of vegetable, more of grain, more of high fibers diet. We should try as much as possible to avoid junk. All these are very, very important. We use salt in moderation. We reduce our alcohol. Alcohol should be in moderation. But if you are diabetic, if you are hypertensive already, we advocate that you even stop it at any point in time. It's very, very important. Although their quantity, I don't want to go to controversy for this sake of production. You should do as much as possible to avoid added salt. Whenever a food is cool, you go to the dining table, you are adding more salt in it. All these are not a healthy behavior. It's very, very important for us. What are those food groups? The star and starchy vegetable group, the food group. We have different kind of food in our environment that are readily available, and we should take them and take them into moderation. Those are the counseling that we normally give if somebody is on dietary restriction. For instance, you have, even there are some foods that you do everything possible to reduce the consumption. For instance, somebody who is diabetic, pineapple is not a good food for the person. Mango is not a good food for the person. There are fruits that are very rich. We talk of glycemic index. For instance, now you are taking your fruit, walnut, spinach, cucumber. All these things are readily available in our environment. Even watermelon, their quantity you should consume. Even apple, their quantity you should consume. Even orange, you should not even take more than 1 orange per day. Then the vegetable group, there are various vegetables that are very that can be available in our environment. Then the meat substitute, egg and shit. Should I stop? Because yes, meats, there are certain parts that you should not just be taking. There are certain parts that you have to reduce the consumption. For instance, if you want to take red meat, it should not be more than your tongue. All these things are very, very important. Then the milk and yogurt, the fat and egg group. It is important to eat food from each group every day. It's not that those are the things we normally cancel. Somebody will come to the clinic and tell you that because of this, I have been told not to eat eba, not to eat food. No, I will say no. It's practically not possible, most especially in this environment. How will somebody tell you not to eat eba, not to eat food? You can eat all these things into moderation. Their quantity, their way we measure it. It's very, very important. Then weight, you maintain a healthy weight. This depends on the individual height. The body mass index have been used. I know the normal range, it will be between 18.5 to 24.9 kilogram per meter square. That's the normal range. Anything above that, you are getting overweight or getting obese. Anything below that is underweight. The normal, we have normal physiological range, which is very, very good for healthy living. The substance abuse, you avoid tobacco use, limit alcohol consumption, avoiding driving and dangerous activity under the influence of drugs. All these are very, very important for our primary prevention. To avoid tobacco smoking, limit alcohol consumption. We don't want to go to this. Then sexual practice, avoid highly sexual behavior, prevent sexually transmitted disease. These are HIV by preventing safe sex, the ABC of safe sex, which is including abstinence, being faithful to one uninfected partner, and usage of condom. Prevent unwanted pregnancy if still in the childbearing age, in order to not to carry unwanted problem in future. So it's very, very important for us to take a cognizance of this. Good side family living is very, very important. You have the family that you can cater for and cater for adequately. All these things are very, very important. Then injury prevention. Injury are frequent cause of illnesses and death in elderly individuals. Take proactive steps to avoid fall. Vis a vis, wherever you want to prepare a bathroom for, we are even advocating that even the bathroom and all those things should be ensured so that they will not be taking a long walk to go to the bathroom. You should take care of the floor of the bedroom, the lighting system. All these things are very, very important. Then you correct visual deficit. If they are tall, glaucoma, cataract, and all those kind of things are very, very important to go for routine eye check. The exercise capacity as your lung can control, as your cardiovascular system can take. Those are very, very important. Dental health, good personal oral hygiene is also very, very important. Avoid sugary food and tobacco. Go for regular dental checkup. All these things are very, very important. Then immunization. This is vaccination against infectious diseases. Appropriate immunization for the retiree may include tetanus, hepatitis, then pneumococcal vaccine, and all those things are very, very important. Now we are talking of COVID-19 vaccination and all those things is on. I want to use this medium now to advocate, to even tell us if there's anyone that has not been vaccinated. It's very important. It provides, it protects a lot of things. It's very, very important. However, there are a lot of myths on this, but I want us to make up our mind and ensure that we are all adequately vaccinated. Those with conditions that depress immunity and those who have the PEP may use other vaccines are very, very important. Then chemoprophylaxis is also part of the primary prevention. This refers to the use of drugs and supplements to prevent diseases. Evidence supporting the benefits of such drugs should be critically examined before taking them. For instance, aspirin taken daily or every other day has been found to prevent vascular disease after the age of 40 years, especially if the individual is at high risk or has a family history of coronary artery disease and no history of stroke or bleeding. All these things must be taken into consideration. Very, very important. Then stress management. Stress can be avoided by planning the daily activity beforehand and sticking to the plan. Don't do anything. Try as much as possible not to do anything outside your plan. Have your routines schedule, have your routine schedule, and you must comply with those schedules. You do everything possible within you in order not to go outside. They avoid taking too much and leave no more. Daily activity should be balanced with adequate time allocated for rest, recreation, and sleep. It's very, very important. It's not just work. We should take time to rest. We should take time to go for recreation, take your family, go for holidays, go for picnics, and all these things are very, very important. Everything should not just be work. They work and exercise at least 3 to 45 minutes, 3 times in a week. It's very, very important. It can be jogging, it can be walking. We should try as much as possible to avoid a sedentary lifestyle. It will not help us for anything. Very, very important. We should also try to avoid stress as the case may be. Then secondary prevention. What are those things we are going to do? Maybe this thing has set in. Is there anything we can do? Is there any investigate this? Is there anything we can do to treat? It's very, very important. These are the interventions that seek to detect disease before the individual develop complaint, before complication settings. All those men are very, very important. This involves you screen for certain disease through physical examination and investigation. The following disease condition may be screened for depending on the individual level of risk. Hypertension, regular blood pressure check should be measured at least twice, although it used to be advocated by the US screening this thing that at least yearly. No, we are saying that you check it every 6 months, most especially if you have a family history or you know that there are risks that prone you to all this kind of thing. Those who are hypertensive may need other tests such as ECG, chest X-ray, echo for further evaluation of cardiovascular complication. All these are very important. Then diabetes mellitus. This is screened through urine, blood sugar, fasting blood, 2-hour postprandial, as the case may be. We have different physiological range value. That whatever that is outside those values is termed as something like. All these things can be done routinely in the hospital. Then glaucoma, high-risk individual with diabetes or somebody with a short-sighted myopia or family history of glaucoma should have their intraocular pressure measured. If it is above what is normal for an individual, we begin to take necessary steps to avoid sudden blindness. The normal range is about 10 to 21. All these are very, very important. When it is measured in as above the normal range, then a step should be taken. Then lipid disorder, excessive blood cholesterol is associated with cardiovascular disease and can be dictated. You can only dictate this thing when you come to hospital for routine medical check, for your fasting blood sugar is taken, and all these are very, very important. The osteoporosis, that's softening of the bone. Screening can be done through dual X-ray. Absorption is recommended after age of 35 and 65. Then breast cancer, every female should learn how to do self-breast examination and do it monthly. Any change from the usual should be reported to the doctor for further evaluation. Vis and vis, change in the nipple, skin changes when the nipple is inverted, or whatever a lump is detected. You should come to the hospital with immediate effect for further evaluation. Don't tell it may be an attack on all those things. No, 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 no. Let's try and take a proper step and do what we should do at the right time in order to prevent all these things. When you are 15 and above, clinical breast examination by a physician as well as mammography should be done. Even we are even saying it from 35 years and above, we can get a basic fact, a basic report from the mammography. It's very, very important. You can do this every 2 years, especially in women with family history of breast disease. There's cervical screening. Every woman who has been sexually active should have a pap smear done at least every 3 years. Women who have had 3 or more negative smear can stop undergoing screening after the age of 65. All these things are very, very important. Then colorectal cancer. This should be screened through early rectal examination as stool occur blood. Rigid sigmoidoscopy may be necessary in some cases. By just doing digital rectal examination, occult blood stool, all those things, we can get one information or the other from all this. They are very, very important. For a male, prostate hypertrophy and prostate cancer are commoner. When you are 40 and above, you are prone to develop prostate enlargement. This can be picked by rectal examination and ultrasound. The cases of suspected cancer can have a PSA, a prostatic-specific antigen, which should not be more than 4 nanogram per liter, or prostate biopsy. From the prostate biopsy, then you can get further thing for proper evaluation of your prostate. All these things are very, very important. There's something we call continuity of care. Following screening, appropriate management of identified disease. Everything should not just be stopped at the screening level. When you screen, whatever that is detected, whatever that is found, there should be care, and the care must continue. The care must be holistic. The care must be comprehensive. It's very important. It's just what I mean by holistic and comprehensive. It's just like somebody presenting in the clinic now. If something detected, maybe type 2 diabetes mellitus, you can counsel the person to bring the other simply for screening. All these things are very important. We know the familiarity of these things. The follow-up care should be carried out preferably by the same physician who now has a good knowledge of the patient. For instance, you presented in the clinic, certain investigations were done carried out by you. Now, I think it's very, very important for the same physician to do a proper follow-up. It's not that you come to the clinic, somebody carry out an investigation, the investigation is now taken to other clinicians, because you are not just coming for the investigation alone. Even other history, head to toe examination must have been done. The family history, past medical history, as earlier stated, must have been done. All these things are very, very important. It is also very important to seek medical attention early when there's any departure from normal. Whenever you see you detect anything in your body, and we advise go to the hospital and seek an appropriate medical attention. It's very, very important. Don't waste. A stitch in time, save 9. A stitch is time, save 9. Prevention is better than cure. Prevention is better than cure. In fact, I want to tell you that 1 gram of prevention is better than 1,000 kilograms of cure. All these things are very, very important. The risk avoidance are very, very important. Then a short bout of diarrhea can regularly lead to dehydration and shock in elderly. It's very, very important. We see a lot of things. You see elderly who have been passing through for the days, staying at home. Now, by the time you are evaluating them in the hospital, they are already coming out with a acute kidney injury from prerenal form. So all these things are very, very important. You should know what to do at any point in time. They should be adequately counseled. Even a trivial fall may cause a serious fracture in an elderly. It is better to have a medical checkup before attributing any symptom to aging. It's very, very important. If we have any role for health insurance in our environment, literally should be encouraged to have health insurance scheme. In many countries, there are public and private schemes that cover retiree. Although even in Nigeria, under the NHIS program, retiree may register as voluntary contributor under the formal sector program. Register with a mutual health association under the rural community program. Register with a mutual health association under the urban self-employed program. All these are very, very important. Those who have children enrolled under the formal sector program can register as an extra dependent. All these things are very, very important. We should consult our NHI for further explanation on this. Before, I think I have to also talk to us briefly about the natural foodstuff and supplement. They are very, very important. They are very, very important, most especially all these antioxidants, all these food that contain antioxidants, they are like mopper in the brain. They are very, very important. Supplements containing vitamin and mineral are generally useful, especially where the diet is deficient. However, they should be used with medical advice. Be aware of the marketing gimmicks of the manufacturer. There are a lot of food supplements around us. We should be very, very careful. What I normally advise before you take any, come to the hospital, show it to your doctor if they are useful to you or not. Then useful supplement will include omega-3 for our environment, vitamin A, B, C, there's zinc and dietary fiber. All these are very, very important. Natural food also include legume, honey, oatmeal, and meat, fruits, and vegetables, garlic, ginger. All these are very, very important. Tomato, onion, etc. They are one way or the other go for the body. The body and the mind need constant activity to remain in good shape. Encourage retirees to share experiences accumulated over the year with others. It's very, very important. Experience is still the way. Experience is still the best teacher. Then volunteer for social works. Mentor younger ones. Read widely. Take interest in new field of knowledge. Recall and relate new items. Interact with variety of people. Use non-dominant hand often. Use all your senses as much as possible. Learn about and travel to places never been before. All these things are just like psychotherapy. They are very, very important and they are very, very good for our health. Before I move further, I just want us to briefly discuss about spirituality and health. We all know that by the time but we all know that in this part of the world, by the people are attaining this certain age, their spirituality, their spiritual level increases. That is the time, that is when they will have time for churches or other spiritual activity. However, spirituality is a way of finding meaning, hope, comfort, and inner peace through connection with an absolute, imminent, or transcendent spiritual force. Studies have shown significant statistical association between positive spiritual activity and better mental health, better physical health, or lower use of health services. The study has shown that some people just work with their belief. That I believe that, I believe that my faith, all those things, we don't joke with their spiritual level. It's very, very important for us as physicians to understand this. Positive benefit, comfort, and strength gained from religion, meditation, and prayer can contribute to healing and a sense of well-being. All are very, very important. Spirituality helps to cope with illnesses, stress, or death are very, very important. Somebody who is terminally, you have to understand this. What gives the person hope, the person's spiritual level, all those things contribute to their comfort. Lower level of display, anger, hostility, and social isolation. Spirituality also impacts positively on many lifestyles of medical importance. Moderate alcohol intake or complete abstinence from alcohol. All these things they are being preached every day. A Christian must not take this, a Muslim must not take it. All these things must be taken into cognizance. Then responsible sexual practice, appropriate diet, and fasting. However, for me, before I conclude, I want us to re-evaluate our life. I want us to carry out pre-retirement plan. I want us to carry out certain evaluation. We evaluate our life. It's very, very important before we do anything, even when we are working in our productive year to the government, when government is taking part of our productive year, we should understand that all these things will have either positive or negative effect whenever we retire. That is why the life you live now will definitely reflect whenever you retire. It's very important for us to take a positive step through by doing routine medical checkup. Are very, very important. I want to conclude by telling us that retirement and aging are avoidable. Whatever that have beginning must end somewhere. There are day of employment and day of retirement. They are very, very important. I want you to know that it's as fast as parenting. Don't say, oh, I still have 10 years in service. When I have about 2 years in service, I will be taking all those things. We should plan for our retirement age. The moment you pick up your employment letter, you start planning for your retirement. It's very, very important, because whatever you do in that your productive year will affect you in future. With the right knowledge and discipline to apply, a lot of problems can be avoided. Delay or manage to make retirement old age an enjoyable period. Retirement is not a period to suffer. It's not basically a period to nurse one terminal illness to or the other. It's a period to enjoy. It's a period to really reevaluate our life. It's even a period that we need that, in fact, if we really want to enjoy at that point in time, it's a period that a lot of things we have avoided. That is what I was saying earlier on, that the life we live during our productive year, we have either physical, either negative or positive effect on us. As a physician, it is part of our duty to prepare our client for the challenges of retirement and old age. It's very, very important. Thank you, thank you, thank you.
Thank you very much, Dr. Charles Atimo. I've been educated personally. Though I'm a doctor, but I saw the view of the family physician. While talking, we had one of the co-hosts just join us in the studio, is the person of Mama T. Mama T, you are welcome to the Women's Talk today.
Good evening, sir.
Good
Dr.
evening, Mama.
We're glad to have you on Real Men's Talk. Thank you so much. The talk has been so informative. So I came in a
bit. You are welcome.
So far, it's been an educative whatever teaching so far. And I want to believe that a lot of people will pick a lot of things from what you have taught us tonight and make necessary adjustments. You also mentioned that we should reevaluate our life. I love that, and I want to believe we are going to all work on that. You also mentioned that we shouldn't wait until it is 2 years before retirement, before we start thinking of planning for our retirement. Thank you so much, sir.
Thank you very much, Dr. Atimo. Mama T, do you have anything question you want to ask me? I know the question, I know the answer. So, do you have anything you want to ask Dr. Atimo on what he has presented?
Atimo, thank you once again. I'd like you to clarify on 2 things. The first one is on loss of memory as people grow older. Is it prone to everybody to lose their memory as they grow older? Or are there certain activities that one involved in when one is younger that could make one prone to having dementia? Or are there certain people or are there certain activities that we do that can help us to prevent that as we grow older? That's my first question.
Oh, thank you, ma. It's a very nice question, very, very nice and intelligent question. But as I've said earlier, there are a lot of things that we need to do. There are certain things that, in fact, they are unavoidable. For instance, the issue of dementia you just mentioned is one of the cognitive, although I didn't really dwell on it. It's part of the thing that I actually really want to discuss, but it's a very broad topic on its own. There are certain things, there are many causes of dementia. We have vascular, Alzheimer, and all those things. You understand? For this time when somebody is hypertensive, is not controlled, diabetes is not controlled, as some other illnesses, they can be prone to dementia later on. But some adult Alzheimer that is begin to set in as the age. You know, I've said something earlier that every organ of our body decline at any point in time. It begin to decline. What happened in 30s? What happened in 50s? What happened in 60s? What happened in 70s? There are certain ages in life that this thing begin to set in. I also mentioned the importance of the food supplement. That some of these things, they are like moppers in the brain. They are very, 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 very helpful. You understand? So what I'm trying to say in this instance that whatever life you live will have a positive or negative impact in the future. For instance, if somebody who is hypertensive is not controlling, is not doing what he's supposed to do, he's prone to vascular dementia. It's a great risk factor. You understand what I'm saying now? But some just setting, even without, some just setting with Louis body, even without all these things, we call them idiopathic. As you are growing older, the brain is growing, the brain is also growing older. The functional capacity is being reduced. So all these things begin to set in. There are certain things that you cannot avoid. But the only thing is this, it depends on the life we are living. There are things that we could do to prevent all these things by proper medical evaluation. Even when the early dementia is setting in, if we are evaluating, we are the regular one that visit hospital for evaluation. That can easily be detected and be managed appropriately. Thank you.
Tamati,
Thank you
you
so
are
much,
afraid
sir.
of presenile dementia. I know that what I know over the years is that from around the patient, one start losing some of his nerve cells, brain cells, it's inevitable. But people that have used their brain well while young, they will still maintain good cerebral function even in their old age. If the brain has been working well, you've been using your brain, you still maintain good cerebral. But if you've not been using it well, the decline may just be so fast.
What about people
Doctor,
that have problem with bad memory even when they are younger?
well, bad memory, Doctor Atimo, I'm not a. What I know is that bad memory is because you don't pay attention to details.
Well,
Attention to I'm listening to Doctor Atimo.
yeah, it happens. There are a lot of things. Autistic, there are a lot of things. In fact, some people, even when they are younger, they are coming with bad memory, they forget things easily and all those things. Those are the, it happens. Those are the things, a lot of them even happen. If I, you know, we said the rate of declining are different. We all age differently. There are even the people at that start of, at that point in time, their brain cells and all those things begin to decline in function. I've said it earlier that we age differently. You can see some people of 100 years old, the memory is intact, everything about their brain function are so much intact. But at the same time, you can see somebody of 35 years old is telling you, is complaining that he forgets things easily and all those things. It depends on how the brain is being used, or it depends if there's an insult from childhood. And all those things are very, very important.
Thank you so much, sir. I'm going to hold on to that keyword. We age differently. I like that. I think everyone needs to understand that we age differently, and it's going to help a lot of people as they grow older. My second question to you, sir, is about how to avoid sedentary life. As people grow older, they're advised to avoid certain activities that are hyperactivities. So in such situation where you are advised by your doctors not to do those kind of activities, like even your exercises should be monitored. How can one, what are those things that one can do to prevent living a sedentary life as one grow older? Is Dr. Timo still there?
He just left temporarily. Maybe his
Okay.
network fluctuated.
Okay. Dr. Samuel, did you hear my question?
Yes.
And maybe you should address that while we are waiting for him to come back. Can I still be heard? Dr. Samuel, can you still hear me? I think we're having some network issues here. Dr. Samuel, I can still hear your background sound. So I don't know if you can still hear me.
Hello.
Yeah.
Mama T is no more here. Okay, I think she's back now.
Coming up. It's coming up.
Yeah. She asked a question. Okay, you are here. Your question.
Okay, your second question, man.
I was asking about how one can prevent living a sedentary life, regardless of the fact that you have been asked to reduce your activities, to stop those hyperactivities. So, in line with that, how can one prevent living a sedentary life as one grows older, and at the same time, you are trying to prevent some certain hyperactivities that could be dangerous to your body because you are growing over?
Also, thank you for the question. There are some structural exercise. There are some scheduled exercise that can be carried out in order to avoid sedentary activity. In fact, we normally tell people, even common carry out basic house chores, walking around. An elderly man wake up in the
Well, the network, maybe his network is not friendly.
And the network has been doing well so far.
Yeah.
Let's see.
And he's still talking. He's still talking actually.
morning walk around the compound. It's part of that. It's part of the red.
The network is fluctuating.
Yes, he's still talking. Mama T, it's nice to have you here. Dr. Atimo, it's nice to have you here. Maybe we should bring in
Thank
our
you.
meeting to a close.
Okay. Please, I'd like to use this opportunity to say a happy married life to my wonderful baby brother, Shegun, and his wife, Ronke. God bless you, my darling brother, and God bless your junior. Happy married life, Shegun and Ronke. Okay, he's back.
Okay, it's back now. So, as I was saying, you have to understand your own system. You have to understand your cardiovascular status, I mean your heart status, before you carry out any exercise. The exercises are scheduled. If it is walking, there are various ways of exercise. For instance, now you can't tell another person to go and swim. You can't tell another person to go and jog, but he can walk around the compound when he wakes up. All those things helps a lot. The exercise have been noted. It improves cardiovascular function. By the way, it reduces the body blood sugar to certain extent, body fat to certain extent. All those are very, very important. Even walking in the room, even sweeping, house chore, moving around the parlor and all those things. There are other scheduled aerobic activities and all those things that can be carried out. But all these things still a function of your cardiovascular status. They are very, very important for you to take into consideration.
Thank
Thank
you
you
very
so
much.
much, sir.
Thank you.
I'm using this medium to wish Tisha Ogun's happy married life. He's joining the men.
So,
So we're getting him one of these days to the real men's talk. Just extend my greetings to him. In the absence of
okay.
I think we can bring the meeting to a closer. Dr. Atima, any final word for us, please, for our audience?
Well, it's very important. After this lecture, we should take one thing home. We should reevaluate ourselves and prepare well for our retirement. The moment you pick your employment letter, begin to prepare for your retirement. I've seen a lot of people now, they are afraid to retire. They are telling you that I still have children, university, and all those things. It's not supposed to be. Prepare well for your retirement. Know what you are capable of taking care. Don't do beyond your capacity. All these things are very, very important because preparation will make us to live a healthy retirement life. Retirement is not a period of suffering. It's not a period to not sickness or the other. It's a period for us to really enjoy. It's very, very important. All these things will occur if we plan well, if we evaluate ourselves and begin to prepare for our retirement now. Thank you very much.
Thank you very much. Mama T, any other thing you want to tell us? No. Thank you. Same time next week here, we will be treating the second part of this topic that has to do with financial preparation for retirement. And that's also very important. Apart from one enjoying good health in retirement, having good source of funding is something we all look up to. Till next week, I wish all of you nice week ahead. Thank you very much.